The vision of the Food is Medicine Collaborative is thriving communities supported by resilient and equitable health and food systems. As a physician caring for patients in a lot of underserved communities, I would often tell my patients that in order to manage your blood pressure or your diabetes, you had to eat well and take these medications that I was prescribing. And I had patients coming back to me quite discouraged and embarrassed that they weren't able to follow this other part of what I had advised, which was eating well. And it would be because they didn't have ready access, they didn't have the funds to do it, or transportation. And in answer to this, I would say, well, here's another prescription. And I found myself piling this on to my patients, and it was just really crazy making that we had a medical system that had a way for us to prescribe medicines, but not to prescribe food. So we started off as food programming and being able to actually offer food to people in clinical settings.
In terms of the Food is Medicine Collaborative, they've been really helpful building our food pharmacy from the ground up.
The food pharmacy has impacted our patients in so many different ways that I didn't even expect. The most obvious way is that some of our patients have clearly expanded the amount of fresh food that they have in their diet, which has a direct impact on their health outcomes. But the other really important part of the food pharmacy is creating this sense of community. And I think that that has really changed the way that people think about food.
And partnering with Arcadios, that brings us the food every week, and knowing that the food is one, fresh, but also is supporting some local farmers can definitely be very rewarding in terms of knowing where that food is coming from.
This is a project I believe is very important because we work with organic small farmers too. So families get the best vegetables. We're gonna help both farmers and communities.
The day begins with connecting with the farmers and setting up the actual orders. So we're bringing out bags of fresh produce, fruits and veggies, and then the people that work here connect them with the community that comes and picks them up here.
We all here just like family. I'm talking about the staff and everything. And I wasn't really no staff, I was just a helper. But they treated me like our staff and part of the organization we have here. And I am part of the organization because they are part of my family. Yeah, they are my family.
And so we have our programming, but we also have an overarching vision of how do we do systems change? How are we creating culture change within healthcare to actually embrace that food insecurity is a health issue? And so by instituting these programs over time and embedding it within healthcare, we started to change healthcare delivery systems' understanding of what their role was in doing this, and then ultimately garnering all those partnerships and that interest and investment in healthcare to achieve greater policy change. And so after a year and a half of advocacy, we actually got our state Medicaid program to include food and medically supported food and nutrition services into our Medicaid. So healthcare is paying for food, health insurance is paying for food, just as they pay for medications and prescriptions.
I'm a cancer patient, and I feel certain that coming to food pharmacy has impacted the success of my treatment. Further, since coming to food pharmacy, my blood pressure has become more regularly normal, and I went from a status of pre-diabetic to normal status.
When the pandemic hit, we really thought healthcare would back out of this work, and we saw the opposite happen. Where we see this work going is ongoing engagement with healthcare systems change and policy change so that we actually create a more equitable healthcare delivery system.
And we have to think about that on a healthcare level, not just each provider, not just each clinic, but we have to figure out ways to be able to incorporate that as much as possible into the healthcare system.
Getting Further Faster was a tremendous opportunity for us to be part of this learning network of other entities that were doing this multi-sector collaboration work to address social determinants of health. I think that's where there's great potential for individuals like myself and people working in the healthcare space that we need to change the system. We are the ones with power and privilege, and how do we turn that around and fix the system that keeps folks at disadvantage?